Hey there, I'm Dr. Barbara Woods, and it's so good to be back again. And today we're going to talk about empowering your therapy practice with knowledge and specialization. So, a little word of warning, my dog Bjorn is kind of walking around. He just learned how to come down the steps into the lower level of the house. He's very proud of himself, but you might see his tail in the background, or he might even pop on to the camera. So he might make an appearance. And before we start, I just want to recognize that right now in the world, there is so much going on with the things in Israel and the war in Ukraine, and a lot of people are suffering now. So just want to recognize that and put some positive energy out there for all those people, and developing better skills so that we can support people that are going through those kinds of difficulties. Today, we're going to talk about offering specialized neuroscience based interventions and excelling in your field in a way that supports you as a therapist, but also supports your clients in their outcomes and progress, also supports referral sources. So, I have a focus on the practice pillars and expertise. So, really honing in on the areas that are important to the clients that I serve and the therapists that I train. Having a compassionate community, so making sure we offer that safe, nurturing space for people to learn and grow, and also using cutting edge knowledge. I've always been one that is looking at the new information and research that comes out and trying to put that into action on an applied basis. So, those are the pillars of my practice and my trainings. And we're going to explore how acquiring this advanced knowledge enhances your therapy sessions, but also helps your professional growth. So we're going to look at the impact of advanced knowledge on our clients. And this is from offering customized therapies and fostering resilience within our clients base. So with customized therapy, the deeper knowledge that you have, the more specialization that you have, the more you can personalize your therapies to specific clients. So you have a greater toolkit and a deeper toolkit to pull from when you're working with clients, especially when you're working with intergenerational trauma. This is a really complex situation that you need a specialized approach, because you really need to know family therapy, child and adolescent trauma, complex trauma, all those kinds of things, and how the child development, your autonomic regulation, and your relational neurobiology. So it's a very complex cluster of skills that you need to have to be effective in treating it. And if you have those deeper skills, you're able to offer more customized therapy for your clients. And that's what my intergenerational resilience method is based on. It's cutting edge neuroscience, and it ensures that the therapists have those highly customized interventions for the families that they're working with. So, with fostering resilience, to me, resilience is really about the resilience of the autonomic nervous system. So, resilience isn't just having a positive attitude all the time and picking yourself back up after something bad happens, because most of our clients have really had a lot of significant trauma that it's very difficult to just pick yourself back up. So, that is not what we're talking about when we talk about resilience. We're talking about the flexibility of the autonomic nervous system to have appropriate reactions that are neuroception that is accurate, and the ability to shift between states without getting kind of stuck. So, that autonomic regulation and that resilience is what helps stop that transmission of intergenerational trauma. And it does that by it starts to shift the interactions and the attachment between parent and child in the current generation that you're working with. It can also work back into earlier generations if they're either involved in therapy or if you can shift the autonomic resilience in one generation, it can affect the previous generations as well. And if we're addressing that autonomic regulation in the parent to support the parent child relationship, we're actually helping support them to resolve unresolved trauma. So this helps improve that attachment, allows for their autonomic resilience, relational resilience, and it allows the resilience from previous generations to be transmitted. So there's intergenerational transmission of trauma. There's also intergenerational transmission of resilience, because a lot of the families that I've worked with, if you look at their backgrounds, there's huge resilience there. They may not be able to see it because it might look like resistance to oppression, and they resist those. That's resilience. So you might have a later generation that is also kind of fights against things that aren't fair or aren't equitable. And that's that intergenerational transmission of resilience. And that is what we really want to see, is that resilience being transmitted between generations. So the knowledge also equips you to specifically help your clients build that resilience across generations. So it's not just about creating change within to have better autonomic resilience and then it impacts the attachment. It's also direct interventions that help shift that resilience between interactions. So it's an internal change and it's also an external change in how they interact. So, how does having advanced knowledge benefit you as a therapist? So, there's a few ways that it does. It enhances your credibility and confidence, and it also promotes professional growth, which is really important because we don't want to get stagnant in our practice and get kind of bored and not excited about it anymore, and that leads to burnout. So, the credibility and confidence is really important for both the therapist and the client. So, if you're well versed in the latest research and latest methods, you can feel more confident and feel like you have a wider toolkit, maybe more specialized skills. And it can also help position you as a specialist, or some would say as an expert. And I always use a little caution when I talk about being an expert, because the minute you think you're an expert, you're going to get knocked down, because we're working with very diverse and difficult problems and things. Once you think you know something, it'll kind of shift on you. So I'm always cautious about the word expert and prefer the word expertise or specialist. But it does help you position yourself in your practice as having a special expertise or a specialized skills. So, therapists who have these specialized skills and this advanced knowledge and a wider toolkit and deeper toolkit, they end up being able to have what's called greater resonance in sessions. So, that's the ability to see a person for what they're going through and their experience, hear them and what they're feeling, and really support them and understand them. And for some of our clients, that resonance or that being seen, heard, understood, we may be the first person that's offered that to them. So it's really specializing can really help you hone in on what is happening for your client and helping them feel like they're compassionately understood. So it also gives us more confidence when we specialize, and sometimes gives us more credibility with referral sources if we have certain specializations or trainings, or we're able to work really effectively with their clients. That always helps a practice and helps referrals. There you can see Bjorn's little tail. So it's also important for professional growth to learn some specialty areas for working. So continued learning and refreshing skills and learning deeper skills helps us grow. It helps us manage our frustration, helps manage burnout. So it's really important to get these trainings and specializations so it helps you keep your skills fresh and up to date so you feel more confident in what you're doing, maybe a little bit more energized and wanting to apply different skills. It also creates forward momentum. So that's always making progress, always looking forward. Of course, being satisfied in the present with the here and now and enjoying the here and now, but it creates that forward momentum. It can also help you build really collaborative and collegial relationships. Some of my strongest colleagues are the ones that I've met in trainings and ended up working on projects together or having different opportunities through having met them. So, that support from other professionals in our field is so critical to helping with frustration and burnout. And then consultation and supervision is also really important for deepening those skills. And that's because if you're pulling from a pool of other people who are working in the same area, you may not have that direct experience of the cases they've worked with or the things that they've experienced or things that worked, things that didn't work. You'll have that indirect experience of what they've been through and what has worked for them. So it can really help support your growth kind of exponentially. There is a caution with specialization and training. You don't want to overtrain either. So there's so many interventions that are available to us that it's very easy to spread yourself too thin and have too many interventions available and not be able to get to the depth because you can't practice all those interventions to a point where you can master them. So you want to train, you don't want to overtrain, and you don't want to be scattered in this. So, one of the things that I've done in my trainings is I've looked for different interventions that can be used across a wide range of clients. So, some of those are brain spotting, EMDR would be one. And for me, interpersonal neurobiology has been really helpful for developing a set of skills that goes across diagnoses, across clients, but it's also very useful and you can get really kind of deep and specialized in that as well. So, one of the practices that I have that's a specialization is treating intergenerational trauma. And I've developed a trauma toolkit and an intergenerational trauma program, which is a large, robust program that helps support very complicated families, because that's where the struggles are for a lot of people. So, what is the Toolkit? It's an online self directed program that provides an introductory training experience. So, it'll give you a taste of applying child development, relational neuroscience, attachment, polyvagal theory, and family resilience in a way that helps promote the healing of the family and stops the transmission of the intergenerational trauma. So, it simplifies that complex scientific, all those areas of polyvagal theory, relational neuroscience, attachment into really actionable tools that you can use right away. The benefits of it is that it equips therapists with assessment and intervention strategies. And it's the toolkit's really for less complicated families because it's not as robust or in depth as the intergenerational trauma program. So you can use it with any family, it doesn't have to be intergenerational trauma, but it helps kind of initiate change in the family system and gives a therapist a taste of what the specialization of treating intergenerational trauma is based on. And it's also a framework for understanding that autonomic regulation, co regulation, and attachment. Okay, so let's talk about building a compassionate community through developing this knowledge. So, the ways that we're going to do that is peer support, mentorship, and networking. So, with peer support, that's sharing knowledge, creating a powerful community of people who've specialized that you can connect with as a resource if you need some support or need to think through something on a case that you've had. Offering peer support also helps address burnout because what we're dealing with is really heavy and it's very isolating because you're in a room with a client one-on-one all through the day. So you have very little time to hang out and talk or discuss things or kind of process cases. And we can't process cases in just a general setting. It has to be in consultation or supervision because of our ethical guidelines. So that peer support can really help manage and prevent that burnout. So mentorship and networking is also really critical. You need programs that don't just educate you, but they also connect you with a network of professionals that are committed to ongoing learning and that mutual growth. So when I got involved in the brain spotting community, it was actually two people in my local area that brought somebody in to train, and that community has grown, and it's all through Canada now. And it's a great professional community to connect with and get that support, learn all these skills, have extra trainings. And it's just a wonderful, supportive kind of body of professionals. So now that we've gone through that, I'm going to ask you, are you ready to empower your practice? So this is really important. It's not just an academic endeavor. This is advanced knowledge. It's the cornerstone of effective specialized therapy. It's got huge benefits for you and your clients. And it also helps you to really attune to and support your clients. So if you are looking to deepen your skills or knowledge about intergenerational trauma and kind of don't know exactly what it is or how it shows up in therapy, because it can be very tricky and it can show up in ways that you're not expecting. So it's really important to have this first step of kind of assessment and understanding what it looks like when it presents in the therapy room. So I've created a free checklist for therapists. It's called the 5 Domains Checklist, and it looks at 5 different areas that intergenerational trauma impacts a family. If you're interested in that, go to 5domainschecklist.com and spell out 5. You can sign up for that there, and that would be amazing. So knowledge isn't just power, it's your path to therapist excellence. Next week, we're going to talk about the intricacies of the power of specialization and tailoring therapy to specific client outcomes. So until then, keep learning, growing, and empowering your practice, and I will see you later.